Back to one of our top stories. Doctors in emergency rooms across the country this morning are on high alert for Ebola.
But is the fear justified? Joining us now is Dan Childs, managing editor of the ABC News Medical Unit, to help us find out what we really need to know about this disease. Good morning, Dan.
Good morning.
Dan, it's great to have you here. So remind us exactly what Ebola is and how contagious is it, compared to flu?
Well, it's something called a viral hemorrhagic fever, and there are a number of different types of these. Ebola is one of those types. In terms of how contagious it is, it's not as contagious as the flu. I'm sitting about 6 feet away from you. If I had the flu and you hadn't gotten a shot, I would cough, I would sneeze. You'd have a pretty high chance of getting this. This is not the case with Ebola. It's not something that you can get from breathing in when someone's near you. We're talking about coming into contact with bodily fluids and having them mingle with your bodily fluids.
And the doctor and the nurse infected that everyone's been watching so closely, they were on the front lines dealing with Ebola. A lot of people wondering, how could they have possibly risked infection? What went wrong there?
Right, exactly. These are health professionals, and there are protocols for dealing with this. Number one is that doctors here don't often see these types of infections, so it's kind of new territory for a lot of people. Also, this is a very messy disease. We talk about bodily fluids. There are a number of symptoms that actually put those bodily fluids out there, and people can pick up on those infections if they are not careful enough and if the area is not decontaminated.
And it does have such a high mortality rate. So many people dying here, but some people do survive. How do you know when it's safe to be around someone who's had Ebola?
Right. In terms of the mortality rate, in this outbreak, we're looking at about 60%. The good news about this, if there's any good news whatsoever, is that once the really bad symptoms, we call them the acute symptoms, start to dissipate, that generally means that people are out of the woods, that you really don't have to worry about it. A lot of the patients who have had Ebola and recovered, 2 to 3 weeks afterwards, they're back with their families. Now, there's certain things that you need to look out for. We know, for example, that the virus can persist in terms of the semen or, the sexual transmission of it for some months thereafter. So the advice is always to wait 3 months before any kind of contact that would involve that type of intimacy.
Interesting.
There are a lot of people who've already been tested for Ebola across the country. If you're not traveling to these countries affected in Africa, do you still have to be concerned? What should you really look out for?
Really, you don't have to look out for too much. One of the things that we know is that this is a type of virus that can live on a contaminated surface for 1 to 2 days. But your chances of living in this country and getting the exposure to that sort of thing, it's extremely slim. So really, people here are very safe. The most important thing to do is not to panic.
Dan, it's so great to have you here. Thank you so much. Great insight. Dan Childs, managing editor of the ABC News Medical Unit. Thanks for joining us, Dan.
Thank you.
We'll be right back. You're watching World News Now.